Hello, everyone. Heather Holmes here with KTVU Fox 2 News. And joining me once again is Dr. Rashid Chotani. He is medical officer at IEM, also an infectious disease expert and someone that we've been talking with now for several weeks about COVID-19. Doctor, always a pleasure to have you.
It's always a pleasure to be with you talking about this very critical and important issue that faces our nation.
Yeah, and Doctor, we really hit another grim milestone this week, more than 200,000 deaths. Your reaction to that?
Well, with 7 million cases and close to now 202,000 deaths, it is just devastating, all the people that are working on this thing, because we definitely do not want that kind of, those kinds of numbers. Everybody calls it a milestone, and I call it a devastation, because, that is 202,000 people that are not going to be sitting on the dinner table with their families, and thus 202,000 families have been affected by this thing across the nation. And what we've seen is that after almost 8 weeks of consecutive decline, there is now a 7% increase in the daily number of cases. It used to be around 36,000 cases per day. Now we are seeing 40,000 cases, and past 10 days, the increase has been pretty pronounced. Deaths are also going up, and we are seeing about 850 deaths per week. So if we continue this trend, you can imagine in the next, even if there are 850 deaths and they stay at that particular level, although we are expecting that the number of cases and the deaths are going to go up because of the winter season, fall and winter season coming on to us, and we'll have more of this disease. It's going to be really devastating for us. One good point over here to make sure that everybody understands is that, yes, the number of cases are going up, but we have definitely seen a decrease in the number of hospitalizations. At the peak, we used to get about 50,000 hospitalizations per day. Now we are seeing around 25 to 30,000 per day, and we want to keep it, we want to take it lower. We want to make sure that those numbers go down. Now, unfortunately, COVID-19 with 202,000 deaths has become the third killer after heart disease and cancer in the United States.
Wow, that is such a grim statistic. I obviously a lot of focus still on, the vaccine. That was the focus of the Senate hearing this week. Talk a little bit about some of the developments that came out of that hearing, and what I guess the promising news is.
Well, one of the critical things that came out of that hearing, and I mean, this was a very interesting hearing. I mean, I wish we had done this earlier, because what we as a nation needed to hear from the healthcare leaders, the four healthcare leaders that were sitting over there, promising and assuring the nation that they will not release a vaccine if it was not going to be safe or efficacious. They will not break any type of guidelines or any type of rules and regulations that are already in place. So that was perhaps the best thing for the nation. I knew about it. We talked about it last time we were together. And I had said that I have total confidence in NIAID, NIH, FDA, and the people that are running Operation Warp Speed, that they will not release a vaccine if it was not good for the nation. What we have done is we have put a threshold, which is not a very high threshold in terms of efficacy, 50% efficacy. If it is safe, these folks are going to release give it an emergency authorization use. Now, there are other factors that are involved in it. There's a special committee that has a predetermined date at which they examine the data on a regular basis. And they look at the data, and if the data shows that there is some adverse effect that is happening, they will stop the study right there and then. If there is something that they see that's incredibly positive, that means that they see that the vaccine is really efficacious and they don't see any side effects, it is safe, they will come out and announce that. So now, with all the pharmaceutical companies pledging that they will not, take any shortcuts in terms of releasing the vaccine or applying for FDA approval, as well as the FDA and the other agencies saying we will not allow that to happen, I believe the population should be at comfort that we've got some really, really good people up there who are trying to make the best out of a terrible situation with 2,000 deaths right now in the country to make sure that something is out there that is going to save lives.
Yeah, and talk, doctor, about this need for Americans to feel confident in the vaccine, because that's really how we're going to overcome this pandemic.
Absolutely. I mean, to be very honest about it, if you take a look at things, the COVID-19 is all across the United States, all across the world. The numbers are increasing across the world. We will be reaching some very grim milestones in terms of deaths across the world. Other countries such as India, Brazil are being affected by it very adversely right now. Their numbers will exceed the United States at some point. In the United States, the maximum number of people that have been exposed to the disease or have contracted the disease or have developed some sort of immunity is not over 16%. 10 to 16% of the population has probably been exposed to the disease. That means that close to 80 to 90% of the population is still at risk, and that is something that we've got to think about. And how do we develop herd immunity with that low number? Yes, with precautions, we brought down the numbers. The numbers are going up a little bit now for a few states, and we've got to be very cautious. But still, the numbers are pretty low in terms of herd immunity. We need about 70% of the population to be exposed or get a vaccine that is going to create immunity, so that we can say that now we are going towards herd immunity in the population. And the only answer to that particular question that you asked is to make sure that we have a good, efficacious, safe, effective vaccine, and people go out and get that vaccine. The entire population goes and gets that vaccine, so that we start developing that herd immunity that we keep talking about and keep talking about. And unless and until we have the vaccine, we would not be able to achieve that.
Yeah, and doctor, we're learning of a new potential vaccine that would solve one of the problems, one of the main concerns about a vaccine, and that is this need to keep it cold. Talk a little bit about the Johnson & Johnson vaccine that's in development right now.
Well, Johnson & Johnson, excellent question. Johnson & Johnson vaccine is a couple months behind the leaders, the two leaders that we have right now, Pfizer and Moderna. But its advanced vaccine trials are enrolling about 60,000 participants in phase 3 right now. And the company is saying that they should be able to provide some results by the end of this year, and perhaps a good vaccine. The advantage to this vaccine, this technology that they're using, is that instead of 2 shots, it will require 1 shot, which is a very important consideration when we are talking about the entire population of the United States to be vaccinated, because it creates less logistical issues. It also does not have to be kept frozen, as it is delivered to the hospitals and other places where it can be given to patients, simplifying, again, the logistics for hundreds of millions of doses that need to be dispensed.
Yeah, as you mentioned, kind of 2 outstanding issues that are addressed, obviously, if this vaccine ends up being successful. Doctor, we did, though, hear about a new development with COVID-19, and that is this new study out of Houston that says that there may be a mutation.
Yes, and that is extremely concerning. And what they've done is they studied over 5,000 genetic sequences of the coronavirus that reveal that the virus continually is mutating, specifically one strain that is circulating in the United States, and it has made it more contagious. So that means that more people can get the disease easier and quicker. But one important factor over there with the bad news that we just talked about is that this virus might change the clinical outcomes and might not be as deadly as the other ones. We are still learning about it, but the research did not really find that these mutations that are being observed in these viruses that they're looking at have made it deadlier. Now, we know from infectious diseases that when a virus mutates, sometimes it becomes more infectious, sometimes it becomes more infectious and deadlier, and sometimes it becomes more infectious and less deadlier. So we are hoping that it's the latter, because the studies that they looked at did not find it to be as deadly as the earlier versions that they had seen, although they did find it to be more contagious.
Yeah, this is just one more study that proves to us, doctor, that there are still so many things about COVID-19 that we don't know. I always ask you for your sort of final thought when we wrap up this conversation, as we wrap up this week, your message to Americans watching this.
So one of the things that the most important thing for all Americans is to trust our institutions, the scientific institutions that we have. That they will not release a vaccine unless and until they are completely confident that it's safe and efficacious. And now, as we are, coinciding COVID with the flu season, I just want to make sure that the population also, our Americans also understand that they need to get the flu vaccine, because you really do not want to have the confusion of finding out whether you have flu or COVID. Now, flu vaccine is not 100% efficacious. It is about 50 to 60% effective, right? But it's better than 0% protection. So if you get a flu vaccine now, either late September, early October, it takes about 2 weeks for it to for the body to develop antibodies against the virus. So it requires some time. And usually we see end of October outbreaks of influenza. So if you take it early October, then you'll be ready to deal with flu as it propagates through the country. And it's much better to have the vaccine taken than not taken. Now, just to just to talk a little bit about, if you don't mind, is the burden of this disease, right? From last year, what we noticed was, and this is CDC data, that 39 to 56 million people across the country got the disease. 18 to 26 million had to go and see a doctor or do a medical visit. There were 24,000 to 62,000 deaths due to flu. And the most important factor over here to consider was that there were about 410 to 740,000 hospitalizations across the nation because of influenza. Now, if we can decrease influenza this year, and if we don't have the burden as we usually have, then we will allow our healthcare systems to be able to deal with COVID. But if we don't do that, what's going to happen is our healthcare systems are going to be overwhelmed, and we'll create more shortages for hospital beds and protective equipment. So get the flu vaccine, trust in the institutions that we have, which are tremendous institutions. Wear your mask, make sure you're washing your hands, and keep the social distancing, and we should make it through.
Doctor, great advice there. Thank you so much. Really appreciate it. Until next time, thank you.
Thank you so much, and have a good day.